Thank you for staying with us. We're looking at reproductive health in the midst of COVID-19. Um, we're looking at the reproductive, mental, newborn, child health in this period. Mama, Papanko.
Papa, no, they were maternal. Thank you very much.
Well, Papa has to be there to support. Anyway.
Well, he does his own job before the reproductive stage arises. And his job is done thereafter.
Okay, well, Alera and I are having this conversation, but don't worry, somebody's here that will help clarify all of that. Well, he's the immediate past chairman of the Senate Committee on Health. Senator Dr. Olaiwaja Adeyemi Tejuosho, a Nigerian politician, who was, as I said that earlier, immediate past chairman, Senate Committee on Health under the 8th Assembly. He represented Ogun Central, a consummate medical professional with specialty in telemedicine and medical computing. Tejuosho was born in Abeokuta as a prince of a dynasty of His Royal Majesty Oba Dr. Adedakpo Tejuosho. CON. I mean, if that, it's not you we are discussing today. We're discussing reproductive health. But if we're going to go into you, I'm sure we'll have the whole day and then we'll still not finish.
Even until COVID ends.
Until COVID ends. But also a part of the conversation is Dr. Sama Ibrahim Anas Kolo, who's a public health specialist and a fellow of the National Postgraduate Medical College, joins us from our Abuja studio. Thank you for joining us.
Thank you.
So just before we did the introduction, I'll stay with you. I'll start out with you and then come back here. Dr. Sama Kolo, Alera and I were going back and forth a little bit about when the papas come into discussing reproductive health. Are they really part of it? Alera says they are before. So help us clarify here before it comes to Dr. Tejuosho. What do you have to say about that?
It's a collective responsibility. So everybody is part of reproductive, maternal, newborn, and child health. It's all about improving reproductive health, maternal health, child health, including adolescent health. And now we've even added care of the elderly as part of that comprehensive response. So it's a collective responsibility, and everybody is part of that responsibility. Nigerian government at the highest level has made that commitment, and that has also been decentralized up to the state government and also the local government level. So the approach now is to ensure that all partners and all stakeholders, individuals, key into that response to ensure that we improve the health of mothers, the health of children, and also our adolescents. That is the only way we can ensure development of Nigeria and guarantee our future.
It's very clear now. Okay.
But let me just finish it here. Since you brought in it's a collective responsibility in this situation that we are in now, the pandemic and all of that. How is that collective responsibility being carried out? Would you say it's wholesome?
Yeah, it is, because as you can see from the presidential level, we have the Presidential Task Force on the COVID response, and similar, it is also replicated at the state level. And then you can see that the role played by our private sectors in supporting, mobilizing resources, and participating. The same also at the community level. Our community key stakeholders, community leaders, traditional leaders, are all involved in the response. So apart from the COVID response, which we are all focused in doing, what is most important also is to ensure that we sustain and ensure continuity of service delivery with respect to reproductive, maternal, newborn, and child health, including family planning services at all service delivery points. And when I said at all service delivery points, I meant at all levels of healthcare, be it tertiary facilities, secondary facilities, and also at the primary healthcare levels. And to that effect, you know, immediately when the first case was reported in Lagos, and since that time, it didn't take time, it started increasing. Within 2 weeks, it came to Abuja, and then started escalating to all parts of Nigeria, and almost all states of the Federation are now affected. So immediately, the Honorable Minister of Health, Professor Osagi Ihanire, immediately instructed, or rather directed, all health institutions, especially those that are under the Honorable Commissioners of Health at the state level, to ensure sustenance and continuity of service, because so that we are not at risk of diverting all health workers to focus on the COVID response. But RMSCH, that is reproductive, maternal, newborn, and child health, should be an integral part of the emergency COVID response nationwide. So this is the focus, and then this is the direction that we are driving at the moment.
Okay, Dr. Joshua, I am picking on the family planning part of this discussion. We're talking family planning in the period of COVID-19. It seems to be a contradiction in terms for me, because we're in a period of a lockdown most of the time, and families are forced to stay together. I use the word forced advisedly. They're forced to stay together, and part of the fun is making babies. And you're telling them to plan their families at this time. How so?
Well,
difficult task.
It's a difficult task. My colleague mentioned earlier that it's a collective effort. But most people, they focus on the woman instead of the man. The man is the source of the beginning of the process for reproductive success. Mm-hmm. And therefore, a lot of advocacy is needed to educate you on the best time to attempt to prepare for reproduction, and the best time when you don't want it to end up with babies. So a lot of advocacy needs to be done. Family planning is all about advocacy, first of all, and also provision of the commodities to ensure that you control the reproductive pattern or what you want to achieve. The problem is more in the rural areas and with the less educated individuals in the country. And we need to let them know the importance of contraceptives. In 2012, there was a meeting whereby they said the contraceptive prevalence rate of Nigeria should increase by 2% every year. Okay, that was in 2012. Then our contraceptive rate at that time was around 16% or so. So they expected that by now we should be around 36%. But unfortunately, it is something subject to funding. Our funding gaps have not been too encouraging. And so it's all about funding, funding, funding. And the parliament that I represent, we always ensure during my time that we appropriate enough money so that this family planning can be funded and we can have contraceptives, and also we can fund the people that are skilled enough to do the advocacy in the primary health centers.
In this situation where you have a reported $7 million funding gap in this year alone, how's that going to work out, even in the face of a revised 2020 budget?
For the purpose of the citizens, so I don't want to make it too complicated. But the issue is we have been enjoying the support of donor agencies like UNICEF, UNFPA, USAID, and so on. But they always give their conditions. And they will say, you bring $4 million, put it in the budget of Nigeria. Then we will do the counterpart funding. When I was the chairman, Senate Committee on Health for Nigeria, I ensured in 2017, 2018, that we fulfilled our part. But it's one thing for the parliament to put it in the budget. It's another thing for the government to release the money. So the gap you are talking about is because of lack of release of the funds. If you look at the budget on paper, it looks good. But it's just the release of the funds at the end of the day that we need to ensure that we achieve. Look at the problem today now. We can see donations coming from everywhere. So now that COVID is on us, everybody is putting down money. It's all about money for health to advance. And we have already put this down on paper. We even went as far as making sure there was a law to ensure that we do not spend and don't get results. It's called the Basic Healthcare Provision Funding, which is in the 2014 Act of Nigeria today. But we have all these beautiful laws that we have done, but it's just implementation that is the issue. all this funding that we're having today, we already said it should go into one basket. Even the donors will be part of the oversight for that funding. We already said this money should go to all the primary health centers in the country. It's in that document. Okay, but again, we will start to prepare another law again, just when we have not even implemented the law since 2014 that we have introduced this.
You know, some would argue that the laws are there, but the National Assembly is not even looking or carrying out its own oversight effectively to see that those laws are implemented.
Yes, that was why.
So that sanctions, if you think that those who are supposed to implement are not implementing, you can sanction them. Are you not empowered to do that?
Well, I mean, we keep on summoning the people to implement, asking questions, but we can only keep on asking and keep on asking. But if they don't do it, it's left to the executives to do the needful and punish who's not performing.
Yeah, but Doctor, government is under a lot of pressure now regarding money because of what we find, the situation in which we find ourselves. So how is government now going to provide, fulfill its own part of the bargain, which you spoke about, before the agencies will put in their own counterpart funding?
Well, in those days when I was in the Senate, we defend our budget. Myself, as Chairman Health, I will defend the health sector of Nigeria. The defense chairman will come and defend his own budget. The education chairman will defend his own. I used to tell all of them that, look here, let us prioritize health. Because without good health, we won't have anyone to operate all these machines you want to buy, the defense equipment. Without health, the farmer will not go to work, agriculture. So why don't we just focus on health first and let it be 100% funding? This is 4 years ago, 3 years ago. So now today we find ourselves now putting everything into health. What we should have done 4 years ago. So it's a matter of priority. Thank God COVID came. When Ebola came that time, all of us were using sanitizers and everything. As soon as Ebola left, we dropped the ball. In fact, I now told the NCDC, we discussed at that time, when there was no COVID, and they even made me the ambassador for hand washing. We did an elaborate ceremony for hand washing. I was an ambassador 2 years ago, before COVID, for hand washing. We did a big ceremony. It was on television, was on paper. It was to ensure we encourage Nigerians to wash their hands. Imagine if that culture continued. Is it today we'll be telling people to wash their hands?
Let me take this to Dr. Salman Kolo. The federal government is about to launch a new family planning blueprint for the period of 2019 to 2023. In this phase of funding issues and implementations and all of that, why do you think we need such a blueprint? And would it be effective in changing the way things are?
The blueprint, the family planning blueprint, is still very relevant. And despite the COVID pandemic, I mean, it is non-stop. Just like Senator Tejoshua mentioned, we don't stop. We still have to continue, and the government is committed to ensure that we continue to implement, to launch the blueprint and also implement the blueprint. With respect to the commitment, I just want to mention and appreciate also Senator Tejoshua for the work he has done 2017-2018 that guaranteed the release of that funding at that time. So I also want to reassure Nigerians that the federal government is highly committed to ensure that those commitments are still met for 2019 and 2020. I knew that partly it was released in 2019, and the government is still committed to ensure that the remaining, the outstanding of 2019 is also going to be released. And I also want to assure Nigerians that as far as we know, the commitment for 2020 is still in the 2020 budget, even though with the revision, despite the COVID response, despite the need also to attract additional resources and funding, because we recognize the very importance of family planning. We also recognize the importance, or rather, if I may call it, child spacing, what the role it plays in reducing maternal deaths. Just like you introduced earlier and mentioned that we are going to expect, because of the lockdown, very increased number of pregnancies and likely deliveries. And we also recognize the burden that the COVID has also placed on the health sector. Prior to COVID, we are still struggling with the human resources, limited human resources in our health facilities. So we do recognize all that, but of course, we still continue to ensure that we continue to deliver services, and all commitments to family planning are also met, in addition to what we are also expecting from our donor. Despite all the commitment, we also recognize we still have a huge gaps of funding, which we are still advocating. And I am happy that Dr. Senator Tejuosho is playing an important role as a great advocate in resource mobilization. And we are stepping out of our usual way of doing business to also begin to attract funding from the private sectors, even for family planning from individuals. And at this, I would like to also seize the opportunity to also mention that, just like I said earlier, it's a collective responsibility. The state government also have to do more, more, because they have to do more in mobilizing and also ensuring, identifying budget lines for reproductive, maternal, newborn, and child, including procurement of contraceptives, because it's directly related to the saving of lives of women, saving of lives of children.
Thank you. Dr. Salma Ibrahim Anas Kolo is the Director of Family Health at the Federal Ministry of Health, and Senator Dr. Olarinwaju Adeyemi Tejuosho, a Nigerian politician who was the immediate past chairman of the Senate Committee on Health. Thank you both for sharing your thoughts with us. So, we'll be back in a moment. Please stay with us.